Hello, I'm Arsha Vahabzadeh, reporting from CES 2018 at a Digital Health Summit live studio. And I'm joined by Sean Parsons, who's the managing director and founder of Illume. And Sean, thank you for joining me.
Thank you. Pleasure to be here, Arsha.
Thank you. You just gave a pretty outstanding talk. What were your kind of key takeaways from your talk?
Thanks. The key takeaway for us is that delivering effective healthcare is about two key decisions. It's about the right diagnosis and it's about the best therapy. And so the reason that Illume exists is to enable, facilitate those two things and to connect them together with the goal of getting patients from sick to well as swiftly and effectively and as accessibly as we possibly can.
That's fantastic. And I know that you're doing that in a variety of ways. So you're connecting patients to clinicians, clinicians to patients. And what are the kind of specific examples that you can give of the technology that Illume has?
Yeah, so we've created a digital tool for doctors. It's a smart device, a little bit like a smartphone, but with the capability to insert diagnostic tests into that device. Those tests that we've created are for common illnesses like influenza, A and B, which is problematic, especially at the moment. Group A streptococcus, which is a major cause of tonsillitis, and sexually transmitted diseases such as chlamydia, which is a burdensome disease on our community. So that exists for a clinician to be able to use these tests simply in the clinical office, obtain a result within 10 minutes, and then to use that result to make appropriate prescribing decisions for their patients. So sometimes that'll be antivirals, and sometimes that'll be antibiotics where that's appropriate. And we want to create better specificity around that antimicrobial stewardship challenge which exists.
So it sounds like you're actually allowing the decision-making data to be accessible in a timely manner.
Absolutely. The time when it matters most.
And then also in terms of the consumers, there's a method where consumers can do some at-home type of testing.
Yeah, so we've taken that same technology we created for doctors and we've simplified it down so it's a piece of technology that can plug into a consumer smartphone. And so we've done this for influenza. About 10% of the population get influenza every year. Most of them don't go and see a doctor, and so they struggle on and suffer on at home. We wanted to create a means where they could buy a test from a CVS or a Walgreens or a Boots. They could diagnose themselves with influenza, and then they could connect the result of that through to a telemedicine consultation to obtain appropriate clinical advice and potentially a script if that's appropriate, maybe a medical certificate if they require one for school or work, and to give them the information and the medicines they need to be able to A, get better sooner themselves, but B, not transmit that as in the community as much, and so reduce the total burden of disease.
So again, it's about just getting that information to the people who will make decisions, whether it's a consumer deciding where they go and their behavior, or the clinician trying to make a prescribing decision or management decision.
Absolutely. We treat the problem as it's the same problem, whether or not the consumer is doing the test or the doctor is doing the test. We want to enable and facilitate the technology to solve that problem for the betterment of the community.
Well, Sean, thank you so much for all the amazing work that you're doing.
Thank you. Pleasure to be here.
Thank you. This is Arsha Vahabzadeh reporting from CES 2018 at a Digital Health Live studio, presented by United Healthcare.